MEnergyL2 ERSR. To get the patient in the position of left side bending with the trunk toward the table, we do a scoop maneuver. So I simply come down here and I quickly scoop the lower extremities toward myself to get the legs into a sideline position and the lower quadrant. From this position, if we have a L4-5 restriction of ERSR, what I'm going to do from this position is to first allow the trunk to block from above. So I'm going to monitor L3, L4. I can pull the patient back into, in this case, rotation to the right, have them rotate toward the table. If there's insufficient rotation, I'm going to have you scoot toward the lateral side of the table. We can have the patient reach toward the floor and then have them pull back into the examiner's hand. Lift up for me. As he lifts up, I resist that to get an inhibition technique working to allow for more rotation, so as to bring the movement to the segment I wish to block. I then relax the patient and have him reach further toward the floor to try to get down to the segment above the segment in which I am performing the muscle energy. So what I've achieved thus far is the patient's in a sideline position we've blocked from above. Now I'm going to take these the legs and use the legs to achieve movement into the barrier. The barrier now being 4-5. It's the segment that I wish to correct the malalignment. So from this position, I'll bring the legs into a flex position until I feel movement in the barrier. If I get movement above the segment, I pull back until I'm within the segment. Then from this position, I'm going to lower the legs so as to get side bending toward the table or to the left, because he is an ERSR. So I lower to get side bending to the left. Once I'm feeling movement at the segment, I'm then going to monitor or palpate the paraspinals on the upper side or on the right for a contraction. I'm going to tell him, raise his legs gently. I monitor the palpation. The contraction is light. It goes for 3 to 5 seconds. He relaxes, and I lower, taking up the available movement, the movement given to me by the inhibition technique, so as to restore left side bending. Thank you.